Congress set to take up 2 bills this week designed to ease the shortage and get formula into the hands of parents. We'll talk to the Commissioner of the Food and Drug Administration about the shortage after this report from Ariel Reshef. Good morning, Ariel.
Good morning to you, George. Despite those efforts, by most estimates, this crisis could take weeks to resolve. In the meantime, many families we talked to say they are desperately searching for formula, and they say the clock is ticking.
This morning, as the formula shortage strains families nationwide, lawmakers in Washington vowing to take action to help resolve it.
We must do something as quickly as possible, but as safely as possible, and use caution for these babies.
The House working on 2 bills. The first, emergency funding to expedite the process for the U.S. to purchase formula from FDA-approved facilities abroad. The second, widening formula access under government programs. That help can't come soon enough for new parents from coast to coast.
It's hard. It's really hard. It's sad. It's scary. I mean, it's super scary. It's the only thing she can eat.
My husband's running to 3 or 4 different stores, just trying to find something.
An average 43% of formula varieties are unavailable nationwide. And 8 states plus D.C. have more than 50% of various kinds of formula out of stock.
We went from having our formula being sent to us every couple of weeks for pharmacy to scrambling and looking all over the place for it.
Mom Amy Dolan, who lives in Flanders, New Jersey, says she's faced a crisis finding the formula her baby Connor needs because of his milk protein allergy.
We've been actively looking all the time. Every night we lay in bed and we're checking what websites we can find and how much it's going to cost. People saw it as an opportunity to buy all this formula and, price gouge at parents who will pay anything.
The FDA now saying it is taking steps to dramatically improve supply in the U.S. in a matter of weeks.
And one of the top companies now warning that this could last through the end of the year. And as we've talked about, many families going to social media to alert one another when there's a restock of formula at pharmacies and grocery stores in their areas. George.
Okay, Ariel, let's bring in the Commissioner of the FDA, Dr. Robert Califf. Dr. Califf, thanks for joining us this morning. You tweeted about an announcement coming this week about how manufacturers and suppliers abroad may import their products into the U.S. What more can you tell us about that?
Sure, George, it's good to be with you and glad I can address this issue, which is of great concern to all of us at FDA. I'm a grandparent of 6 kids, one of whom is an infant formula kid, so well aware of what's needed. So we are moving on the product that was intended for other countries, and I anticipate that by the end of the day today, we'll have a detailed announcement about how that's possible. Remember that the instructions need to be in a language that can be understood by mothers and caregivers that are putting the formula together for these infants. And also we have to be able to test the formula to make sure that the 30 required constituents are actually there in the right amounts.
So nothing's going to be coming in that's not safe.
That's right. We're going to assure that the product is tested, that it's coming from reliable manufacturers, most of whom we know quite well already, and that we do the testing that's needed on the basis needed to assure that it's safe.
Abbott is saying it's going to take 10 weeks to get their factory in Sturgis, Michigan, which had to shut down, back up and running. Anything you can do to help them move that along more quickly?
We are working really closely with Abbott, and I expect that in a very short period of time, we're going to have an announcement about the path forward. I think we've figured out what to do. Abbott's recently indicated that as short as in 2 weeks, they can be in action and begin to do their part in getting supply back on the shelves. Of course, it takes longer to get in full motion. And George, I want to point out one of the examples that you gave in your show of an infant who has special needs. That is really of critical importance to us at FDA. We're looking at case by case to make sure that no infants go without the formula they need. We recognize it's difficult for parents and may take some time, but we'll get there in each individual case. That plant in Sturgis, Michigan was making a number of special formulas that are really life-saving for infants, and so we have a whole team that's doing nothing but working on making sure that that formula can get out even from that plant when it's going to be life-saving.
Some have suggested invoking the Defense Production Act to get more manufacturers up and running, speed this along.
I don't think we need the Defense Production Act. I think the manufacturers are ready to go, and they're going to increase their production. In fact, they already have. Importantly, there's been more formula bought, about 10% more in the last month than in the month before the recall. So there is formula out there. It's just not in the right place at the right time. So this issue of the supply chain and how it gets disrupted when a major manufacturer has to shut down a plant, is a real lesson for all of us that we're working on rectifying, but it is taking just basic work to get the supply chain right.
Some parents in a desperate situation may move to make their own formula. Remind them why that's a bad idea.
That's a very bad idea because formula, as I said, has 30 constituents that have to be there in the right amount, 10 of which, if they're there too much, if there's too much of that constituent, can be dangerous. So formula for infants is a total substitute for breast milk, which God is, for reasons we don't know, made into a magnificent nutritional supplement. So we need the infant formula. It's critical for so many families, but it's got to be the right stuff.
Dr. Califf, thanks for your time and your information this morning.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.